Thank you for tuning in for our Fraxel Laser Live Q&A. I'm your host, Shallon, Patient Care Coordinator for Dr. Gross. And with me today is Jessica White, our nurse practitioner.
Hi guys, how are you?
Here at Primary Plastic Surgery. She's over 12 years of aesthetic experience and is a master injector with cosmetic treatments. So this edition of our Facebook Live Q&A, you're going to learn about Fraxel lasers, what to expect pre and post treatment, and have your questions answered by Jessica herself, the expert. We've already received a bunch of questions leading up to today's broadcast. So thank you to everyone who submitted questions. We greatly appreciate it. And if you'd like to submit a question anytime during this, please make sure to send it in the comments, and we'll get as best as we can to try and answer them all. So first question for you, Jessica. What does Fraxel laser do for the skin?
So Fraxel is a dual laser. It can address multiple things. It addresses pigment, sun damage, surface scarring. Each treatment is designed basically on what kind of needs the patient has.
The concern that they have specifically for their skin.
So we can adjust the laser because it is a dual laser to address whatever concern that we have.
Perfect. So follow-up question to that, what areas of the body can the Fraxel laser be used? I know here we specialize in faces, so in regards to that, what would be the best areas or most treated areas?
Right, so we do mostly, from the neck up. So here we do a lot of Fraxel to chest and décolleté areas, necks and faces. There are other places that can be treated, but that is our specialty here. So
okay. And then how is it best to prepare for a Fraxel laser treatment if you're at home as a patient?
So getting prepared for a treatment, we always do our consultation with you. We make sure we go over our checklist with medications. There are some oral medications we will have you stop beforehand if it's safe, because they can make you more sensitive to heat and sun. We have you stop retinol products for about a week or so ahead of time, and we don't want any recent or sun exposure right before the treatment. We want your skin nice and healthy.
Yeah,
and
make
healed.
sure there's no sensitivity before we do the laser, right?
Exactly.
Okay, great. So next question, how long does a laser treatment take, and how many treatments will a patient need? That's a really great question.
Right. So as far as Fraxel, we usually do it in a package depending on what we're addressing. If we're doing pigment versus superficial scarring, a patient we're addressing acne scarring or a previous surgical scar or dog bite scar or something like that. That might take a couple more treatments. So we do everything in a package, and we kind of give you an average. Hey, this will be maybe 6 to 10 treatments, 4 to 6 treatments. We let you know ahead of time, and we package everything together.
Creating a proposal. We love to create proposals here at our practice so that you have everything before you make your decision, move forward.
Right.
Yeah, that's great. So next question, what should I expect during the treatment, and will it be painful? Everybody loves to know about that one, right?
So we do everything to keep you comfortable when you come in for your consultation. We do highly recommend pre-medicating. We also numb the face topically. We have a very strong BLT. It's a 3 combination numbing that we apply, and actually twice we reapply it. We usually have our patients have a ride home. We want to keep you nice and calm, make sure you're not having any discomfort during the procedure. We usually do, something to help with the nerves, and oral medication, more or less.
And then during the treatment, what will they will they feel anything during that time, or just warmth?
Yeah, everyone's a little bit different. Pain is subjective. Okay. I would say sometimes people breeze right through, no concern. Sometimes it's a little on the warm side.
Yeah.
But we have a device called a Zimmer. It blows nice cold air on the skin.
Great.
So it cools you down as you go, and we kind of,
awesome.
Cater our treatment to keep the patient as comfortable as possible.
All throughout the treatment. Yeah. Okay, great. So how much downtime would I need after a treatment, and what results would I expect as I go through kind of the process?
So right after, you're pretty red, kind of like a windburn, pink-red color to the skin.
Okay. That
can last for about 24 to 48 hours depending on the depth or what we're addressing. Sometimes the patients will say they have like a sandpaper, very light peel consistency. If we're treating superficial things, if we're doing a deeper treatment, you might have maybe 4 to 5 days of a little bit of peeling. It's a slow healing process.
Okay.
Most people are completely fine putting on makeup or tinted sunscreen within about 2 days.
Okay.
And back to work. So.
Okay, great.
Mm-hmm.
So that's really great. So I want to thank you. Next question. What can and cannot do after the treatment?
So, okay, so can and can't I? So you can go home and rest. We can do cool compresses. We don't want to put direct ice on the skin. We kind of want to let that heat expel itself. Just keep the skin cool. Stay in a cool environment. So I don't want you going to the gym, no saunas. I don't want you outside in a hot environment for about 24 to 48 hours, depending on the depth of the procedure, which we do cover. All of the patients, I highly recommend a product that is specified for healing with any kind of a laser or surgical procedure. This specific product we do sell here. If for some reason the patient doesn't want to purchase that product, I do give them, a sample to go home with, but just gentle cleansers, regular moisturizer, avoiding those retinol products or anything harsh, no microdermabrasion or Botox for about a week, no other procedures or anything important, just to let the skin heal and recover.
Yeah. And then, is the Fraxel treatment safe? So
Absolutely.
That's something, of course, everybody always wants to know, always wants to be on the safe side, especially in today's society where there's so many different treatments out there.
Right, absolutely. Each handpiece is sterilized after every patient, so there's no cross-contamination whatsoever. It is safe for all skin types.
Oh, that's great.
Yeah,
that's really
so we can adjust our settings depending on the patient's skin type and the sensitivity of their skin, each medical condition. So it's definitely safe. It's all skin types. It can address so many things. It's, a very beneficial laser to have in our office.
FDA.
So FDA approved, absolutely.
Fabulous. Okay, thanks. So one of the last questions that we have is how much does Fraxel cost?
So cost is, once again, something we put into a package. So if we're doing a full face and neck décolleté, of course it's going to be, a little bit more expensive, unless I'm treating a smaller area, or just acne scarring on the cheeks or a small scar.
Yeah.
So everything is going to be put together in a quote when we do our consultations.
Okay. So that's all we have for the questions that we have, but we do have some questions that are coming in that we were going to be coming in live with. So just a couple more questions that we've gotten in today. So when you're doing treatments with a patient and you start off with a consultation, what do you usually go over with them individually? Let's say if it was somebody coming in for acne scarring, like they specifically had acne scarring, they'd already come in for their consultation. What are you telling them to expect for that? Versus somebody who's coming in and their problem is like some deeper pigmentation. They've been in the sun for a really long time. So what's the difference between those two types of treatments?
So the pigmentation is going to be addressed a little bit more superficially. So you would definitely have that sandpaper consistency. Your healing time is going to be a little bit, shorter.
Okay.
It's really important to avoid direct sun exposure after that, because if we're trying to correct sun damage, of course you want to protect the skin, and sunscreen is super important.
Yeah.
When it comes to treating acne scarring, if a patient is still in a cycle where they're having acne on a regular basis, or maybe a cyclic acne with, a cycle or period, it's very common to have a small outbreak after a procedure. So we do cover those things, and I'll cover them if I need to with a medication.
Oh, okay. And that's
Fraxel,
great to know that you'll actually prescribe them something.
Oh, absolutely.
She has an amazing dermatology background too, so she can help address like skin concerns.
Yeah, and we definitely want to make sure everybody gets the ultimate outcome, and
of course,
we can do
full
whatever we
care.
need to do to make them very happy.
That's great.
As far as treating a scarring treatment specifically, the patient definitely needs to be cautious with sunscreen.
Yeah.
We want to protect that skin, and
A little bit longer for the acne.
Else I was going to say. So your downtime's going to be a little bit more extended because it's a deeper penetration.
Okay.
Because we can adjust that laser to exactly what we want to, the depth that we need to treat.
Because we're working on scarring, which is like deeper in the skin, I would imagine, right? So that's going to be a little bit deeper of a treatment, a little bit longer term, like healing process.
Absolutely.
So they're going to have a little bit more redness.
Yeah, a little more redness.
Yeah.
You know,
maybe
they
more
might
peeling.
be looking into that 3rd to 4th day to being almost completely, you know, back to normal with the appearance of their skin.
So another great question that came in through the live is, can I wear makeup after? So for our females, you know, and guys out there who like to cover up, you know, some of their imperfections on their skin, how quickly, like after the treatment, would they be able to put on makeup?
Most patients are good to go within 48 hours.
48 hours.
Yeah,
okay, that's
definitely
really great to know.
tinted sunscreen is completely fine.
Oh yeah, that's a great idea.
Thicker foundation or makeup, most patients within 48 hours, but we specify that with each patient.
When they come in.
Yeah, if they need more downtime, then we definitely let them know and give them post-op instructions.
Okay, great. So. All right, and then last question is, so when you've been doing these treatments with patients, I know you're a master, you know, certified with all of our lasers, all of our injectors. When you do these treatments with patients, how do you help them through the process if they are starting to feel pain? So if they're in a treatment and they're starting to feel pain, 'cause, you know, pain's like the big thing that everybody always talks about.
Right. So, like I said, we can kind of
starting off
break down the areas that we go. We don't have to follow a specific pattern.
Okay.
I can kind of jump around a little bit if I need to give certain areas of the face a break. We do topical numbing. If we need to take a break, take 10 minutes, walk away, we can.
That's amazing.
We do provide Xanax for patients that need it. It really does make it a pretty easy process for them.
It seems like you guys go above and beyond to really make sure that the patient is cared for, which is huge.
Yeah.
You know, I know that a lot of patients, their biggest thing is that pain. So taking that time to really care about them, that takes like a lot of extra care. I like that.
And I mean, honestly, it really doesn't happen often, but we do have, you know, pharmacy medications in the back. If we really need to do anything,
you go above and beyond.
We can do that. I am, absolutely.
That's great. Yeah. Thank you, Jessica. Well, our time's about up for this edition of our Facebook Live. If you missed any part of the broadcast, you will be able to catch us in our archives. Our episode that'll be available on our social media pages might be on our YouTube channel, so definitely check that out. We'll definitely be trying to post it on our website, wedofaces.com, so check it out there so that you can check out Jessica, find out more about the Fraxel laser. I want to thank you, Jessica, for sharing all of your insight and all of your experience, because I know that you're amazing at what you do. If you're viewing this live right now and you want to take advantage, call us by the end of tomorrow. So you have the rest of today and tomorrow, Friday, to receive 15% off of our Fraxel laser packages. And you're going to use the code Facebook Live. Okay? And I want to thank you again, Jessica, for being here. We really appreciate your time.
Of course, yeah. Thank you guys so much for tuning in. If you have any questions, please give us a call. Once again, like Shalyn said, that code is Facebook Live. Just give us a call. You have until the end of the day tomorrow, which is Friday. And the phone number here is 407-333-3040. And we're looking forward to hearing from you soon.